Welcome to my Wellness Wednesday webinars. Every week I join you and I bring you information about different parts of your body and different health conditions. I hope you find these presentations informative, helpful, and hopefully they can make a difference in your life. My name is Dr. Romina. I've been a chiropractor over 25 years. I also am an inventor, a lecturer, and a mom, and voted the best auntie. So I take a lot of pride in the last two. So let's talk about ankle pain. So today we're going to talk about ankle pain and see how we can help you to take care of yourself a little bit more at home and be more aware about the problems. So let's find out about the anatomy of the ankle. But before you go into identifying the pain, let's see what the problem is and what is the structure that's causing the problems. So your ankle joint is a hinge synovial joint. That means that it can move in different directions and it has a fluid in between the joints. And it creates an articulation between your talus, tibia. Talus is right back here. It's look like a little saddle, right at the joint at the end of your leg bones, lower leg bones, and before your foot arch, foot area. There's a little connection. That area is called talus. This is a very crucial bone. It's very important in its functionality, which we're going to discuss a little later. Then you got your tibia and fibula. This is your tibia bone where a lot of shin splints happened with poor ankle stability. You have your fibula, which the end of your fibula causes that protrusion on the outside of your ankle. So if you just take your fingers and touch the outside of your ankle, that bony prominence, that is the tip of the fibula. Now, the important part about the ankle joint is the fact that this joint can move in 360 degrees, and it's crucial in connecting the foundation of your body to the rest of the appendages that are sitting on it. So it's a very crucial joint. It's very important. And I highly recommend you continue listening to this because you might find something very important, especially for ladies who wear high heels. If you're like me and you enjoy your heels, you definitely want to listen to this part. So the facets, or the connection between the two bones, we call them facets, where they glide on top of each other, and they form the lateral borders of the joint. So we have the outside bony prominence, we have the inside bony prominence, which is the end of tibia, and then we have the actual dip in the ankle joint. So if you flex your ankle, if you put your finger on your ankle and flex your toe, that crease is right here, which is the connection between the talus, the tibio-fibula talus joint. So here we go. Now that we know what we're dealing with, let's talk about one more thing before I move on. Your joints are held together by soft tissues called ligaments. So I want you to pretend the stack of Legos that are connected, not snapped together, but are connected together with scotch tapes. Those are called ligaments. They are what holding the bones together. Now, a reinforcement of the connection is the end of a muscle which turns into a tendon that attaches to the bone. And that's responsible for the bigger movements of the body, whereas ligaments are mostly responsible for micro movements of the body, right? So exercises such as isometric exercises are very effective for ligaments and tendons, whereas more gross exercises are good for your muscles. But that's a little side tip, and here we go. The whole purpose of these webinars is to offer you tips, and so listen up. What type of ankle pains are there? There's sprained ankle is the most common. It's damages to the ligaments of the ankle, and it usually occurs with twisting and turning of the foot. So if you're a runner, if you play soccer, basketball, football, tennis, you definitely are going to be experiencing sprained ankles more than an average person. Then there's high ankle sprains. Now, high ankle sprains are mostly happens between what we call the syndesmotic ligaments, and that is the connection between the tibia and the fibula. That is the connection between these two guys right here, and that's where it's at. Typically happens in eversion injuries, mostly with contact sports, right? So let's keep that in mind. It takes a little longer to heal because obviously it's involving a lot more area and I'll keep on talking about that. Then we have ankle fractures. Obviously, you know, fractures, we all know that's quite painful. And the problem with ankle pain is you don't get an ankle fracture, you get an end of the tibia and fibula fracture, but it affects the ankle joint because that's what it's stabilizing on. Then you have ankle arthritis. So there's two different types of arthritis. There's rheumatoid arthritis and there's osteoarthritis. Osteo, by definition, osteo means bone, arthro means joint, and itis means inflammation. This is the most common type of ankle problem experienced mostly with repetitive stress injuries. A long time ago, we used to think it's the old people syndrome, but it's not, because it's actually wear and tear over a long period of time, which people are becoming more active. And if you have instability or poor body alignment and you're physically active, you are going to be prone to degenerative arthritis, also known as osteoarthritis. Then we have the rheumatoid arthritis, which is more of a lesser percentage of arthritis. It's almost in the single digits, like 6 to 9% of arthritis. The problem with rheumatoid arthritis is your immune system starts attacking itself. So the body attacks the joint tissue, causing wear and tear at the joints, deformity, pain, swelling. It's just really nasty, which you really want to take a blood test to confirm that if you're having joint pain, or an x-ray would actually identify that too. Then you have another type of inflammatory disease, which is gout. Gout is actually accumulation of uric acid crystals deposited in the joint, and they tend to deposit more around smaller joints, such as elbows, feet, toes. So diet will play a humongous role in treatment of gout. But again, remember, it's called the rich man syndrome, which we're talking about cheese and alcohols, wine especially, steak and meat are typically aggravating factors of uric acid deposits. And then you have the psoriatic arthritis, and one of the major indicating factors of psoriatic arthritis is obviously swelling and pain in the joints, but you always have a skin condition associated with it. Diet does play a role, but treatment is more effective and diet is complementary, okay? So when do you contact your physician? You contact your physician if you have a sudden ankle pain. If you fall, you have an injury that triggered the pain. If you're limping, you feel like there's a deformity in your ankle, there's bleeding, or there's ecchymosis, bruising around your ankle without any reason. If you hear a pop and a noise and then you can't walk, you definitely want to contact your doctor. And if you notice that you can't put any weight on your ankle, please do call your physician. Don't try to be a hero. It's better to be smart than to be regretful. So let's talk about what happens when you do come into the office and we do need to check you. So one of the things you do is we identify a problem by doing a physical examination. So it's whether an ankle fracture, whether it's a fracture, a sprain, or any other problem. We need to identify if your problem is muscular, skeletal, or arthritic, right? Or other. So let me tell you how we do that. First, it would be an analysis, a posture evaluation, or a full analysis, because just because you walk in with ankle pain does not mean that is the location of your pain. It could really just be an expression of where the body is showing itself. And if you have weak ankles and you have other conditions and other situations, be sure that the weaker area is going to be affected first. So how do we identify that? Obviously, it's going to be inspection, palpation, range of motion, resistive movements to identify, okay, what are we looking at? Then to go through a process of elimination, we take an ankle x-ray. So an ankle x-ray is typically front, side, and slightly rotated in, where we call it inversion view. And we want to look for the ABCs on an x-ray. What's the alignment of your bones? How's the integrity of that alignment of the joints, right? And is there any bone integrity disruption? Like, do you have a hairline fracture? Is there damage to the bone? Is there any kind of malignancies in the bone? Then we look at the joint presentation. So in an x-ray, the spaces between the white tissue, which is the bone, and the gray area, which is the soft tissue, and the black area, which is airy areas, the joint presentation has to have an integrity of those joints, have to have a little space between them. So you can kind of identify them. It looks like a little stream of river between white little stones, right? So just visualize with me. But identifying those joint integrity is going to be very important. And then soft tissue swelling. You actually would see soft tissue swelling on an x-ray when there's fat pads are risen. But sometimes an x-ray doesn't show anything, comes back normal, and you're still in pain. So the follow-up to that would be either a stress x-ray, where we put you in a position of discomfort and take an x-ray, or we do an MRI scan to identify what's the integrity of the ligaments, because ligaments are not seen on an x-ray. So let's say we identified that there is a problem. And let's say you do know that there is a problem. One of the things you need to know is it just my ankle, or do I have other body overloading, other body abnormalities overloading my body? So if you look at the green person here, and if you look at the white line with these little pit stops, we call this plumb line. The big circle here is around your earlobe. This is middle of your shoulder. This is side of your hip, side of your knee, and that outer ankle area we talked about, the end of fibula, I'm sorry. They all have to be in one straight alignment when you're standing comfortably in a neutral position. If you are not standing like this in this plumb line, and you think you might have any of the other ones, your biomechanics are overloading your body. So take your body weight, multiply it by gravity, 9.8, and add the other components of the severity of your posture affecting your feet with every step you take. So be cognizant of that too. So during exam, we do look at other areas. But with the most common ankle injuries, we're going to focus on musculoskeletal problems. In this webinar, I do not go into pathological conditions. So we're going to stay on the typical and the most common area. And there's 3 types of ankle injuries. You have inversion injury, where your foot goes in and it creates a tear in the outer area around your fibula and your calcaneus. Then you have eversion injuries, where your foot is more inverted towards rolls inside. And then we have high ankle sprain, which is actually the ankle, the foot is stable, the body moves. You see that a lot in soccer players or football players, where the player is standing and stable and somebody just tackles them from behind and the whole foot is shifted over from side, or more of a rotation injury. So let's talk about that a little bit more in depth. Inversion injuries. It could even happen if you're walking with heels and you miss a step and you just roll your foot in. The severity of your problem are categorized into different grades. So the calcaneofibular ligament is a ligament that stabilizes the tibia to the calcaneus, which is also known as your heel bone. So that kind of injury, if it's minimal tenderness and swelling, that's really just a sprain. That is called pulled the ligaments. It just pulled it a little bit. You still can move around. Maybe you're kind of limping a little. During those areas, it's microscopic tears. Even though it's microscopic and it's very little, maybe your pain scale is between 3 to 5. But you have to make sure that you wrap it and you make sure you take the load off and get started on physical therapy immediately, because this can become a problem much later on, especially if you're a girl and you wear heels, especially if you are a male or female and you're a runner, or you tend to have a type of job that requires you to be on your feet a lot. These, unfortunately, grade 1 type of injuries are very much neglected by people, because most people are pain-oriented or pain-motivated. So let's be more intelligence motivated and knowing and understanding that there is a microtraumas will cause a problem later on if left uncorrected. So on a grade 1, you might want to sit back for this. On a grade 1 sprain strain, I want you to focus on about 12 to 24 weeks of therapy. I know, crazy. Even though you feel the pain gone within 2 weeks. But the problem is pain is the tip of the iceberg. This is an area of your body that stabilizes and holds your entire foundation is on your ankles and your feet. So do not take this lightly. It will come back 3 to 5 years from then and haunt you like mad, and affects your knee, hip, lower back, and it can even cause you headaches. That's another problem. So let's talk about grade 2 type of injury. You have more of a moderate tenderness, you get more swelling, your range of motion is reduced, you can't move your foot in all directions and your ankle, and there's kind of instability. If this is left uncorrected, it would create popping in your ankles. So you know that there's some kind of a complete tear, but not all the collagen fibers are affected. So you want to make sure that you definitely get that x-rayed, MRI'd, and start your rehab, immobilized on immediate basis. On a more grade 3, where there's an actual tear, there's significant swelling and tenderness, again, x-rays, MRIs must be followed, and you really would be considering some kind of a surgical or reconstructive surgery, right? So remember these 3 ligaments. Your calcaneofibular, so this is calcaneus, this is fibular, so we call it calcaneofibular. The deltoid ligament is a triangle between the tibia, the talus, and also the navicular bone, and it looks like a little triangle. That's why we call it deltoid ligament. And we have the syndesmotic tear, which is between the connection between the tibia and the fibula. So these are the ones that you want to remember. There's 2 different types of treatment. There is a medical and there is holistic. So we call it allopathic, which is medical, versus holistic treatment. There's a time and place for everything. You can't just identify one or the other. So why not have your cake and eat it too? So let's dive into this a little bit. Typically, an over-the-counter medication such as ibuprofen or naproxen, NSAIDs are over-the-counter. And then we have naproxen, which is more of a SEDS, which is more of a prescription. Then you might want to consider cortisone injections, and that is recommended by your doctor if it's needed or not. And then obviously we have surgery, and there's different kinds of surgeries. There is syndesmotic screw where they connect the tibia and the fibula. There's arthroscopic surgeries where it's more of an outpatient. You go in, the doctor goes in with the arthroscope, fixes the problem, or there's a full replacement surgery. But before you get to that, why not see if we can do something more therapeutic, more holistic, more natural, right? So exercise is one of the most important factors that's going to help you. But I want you to consider exercise not just for your ankle, but for your whole entire body, because we are one unit that are connected together, like a chain reaction. We call it a kinematic chain. PRICE is something you want to remember. It stands for protected, rested, iced, compressed, and elevated, okay? And then we have physical therapy. Obviously, you want to see a chiropractor if you want to address the skeletal body along with the muscular. So chiropractors work on soft and hard tissue of the body, whereas physical therapy mostly works on the soft tissue of the body. Acupuncture is fantastic for pain management and also finding out if there's other factors that's causing a referral pain pattern. Low impact exercises, stretches, resistive training all have a time and place. So, but the goal is to reduce pain, improve mobility, and increase and prevention. That's another factor. So let's stay on this topic a little bit and talk about the compensatory aches and pain. Remember when I told you we do a full evaluation of the patient when you walk in? Every part of your body is connected to each other. If your foot has an inversion problem, or if you have flat foot, fallen arches, high arches, you really have to consider the fact that every step you take ricochets back to your knee joints, your patella, your hip, your SI joints. It can even cause sciatic problem. It will cause low back issues. It will even aggravate people who already have scoliosis. So if you have scoliosis, you're listening to this, please make sure that you get your feet checked as well as being treated for your scoliosis, because they all go hand in hand. And don't be surprised to have recurrent headaches if you have problems with your feet. So let's talk about your feet, talking about arches. Look at you, take a old pair of shoes. Sneakers are the best, especially since you spend a lot of time. Or if you wear sandals a lot, grab your sandals, an old one, and just look at the type of wear and tear that your body is going through. And this will tell you what is really going on with you. Your shoes speak volumes about your biomechanics. So if you look at a normal foot should look like that. A slightly arched, you can see your heel, you can see your toes. And if you want to know if you really have normal feet, put your feet in wet water, put your feet in water, get them wet and damped, kind of like shake them off so they're not dripping, and stand on 2 pieces of paper. Count to 10, then step off and look at the imprint that your foot leaves. And cross-reference it with this image. Do you have high arch, like you could barely see the foot touching the paper? Or do you really have your whole foot on there? And then cross-reference it with your feet. Is there a severe overpronation and severe inside wear? Or the front of it is when you toe off with your toe, but you're standing on the back of your heel? And this is an overpronation mild, which is more dispersed into the area of your foot. So if you get your pedicures, you really develop calluses around here. The formation of calluses is another indication of how you're holding your body mechanics. So next time you go for mani-pedi, look to see where your calluses form. That tells a lot about your biomechanical abnormality. And then obviously the normal. And here's the people who are mostly high arches. They tend to stand on the side of their feet. And most, unfortunately, people like that tend to have a lot of medial joint problems at their knees. And people like that tend to have a lot of meniscal injuries. So think about it again. And hip, also a lot of hip problems. And if you're a runner, IT bands tend to get very tight. So when we look at your body, when you check your footprint, come back and take a look at your body. We look at your body on the 3D plane. We call it sagittal, coronal, and transverse plane. And we look to see, why is there a problem? Is it associated? Is there any other areas? Is there scoliosis, like something very vivid and problematic? Is there any hip issues? Are there any knee issues? What's going on with ankle and foot? And typical things you need to watch out, especially when you're working out, is do you get frequent falls? Do you find yourself to be clumsy? If you're a type of person that is, let's say you're in the kitchen and you're moving about and you twist and you kind of trip a little, or you have to find your balance, you definitely want to get your feet checked and get your spine checked as well. If you have one-sided pains, headaches, foot pain, back pain, these are all indications that you need to get your body checked before it settles into one area and causes severe damage. The type of exercises you choose are really based on your body type. But one thing that I want to share with you is, we don't talk about fascia that are actually encapsulating your muscles. What are the things that I want you to think about when you're exercising? There's so many options available on the web that you can choose and learn about different exercises. But one thing I want you to keep in mind at all times is the muscles in the front of your body balance the muscles in the back of your body. And the muscles on the right side of your body balances the left side of your body. So if you think with that, so if you're exercising, make sure that you balance exercise. If you're doing upper body one day, make sure you do lower body the next day. And balance your workouts between the front muscle groups and also the back muscle groups, as well as right and left. One of the things you can also do is you always have to check points to make sure that your biomechanics is intact. Make sure your feet have good stability at shoulder width apart when you're doing lat pull downs. If you are doing any kind of rows, pulls, and pushes for your upper body, make sure that the alignment between your earlobe and shoulder are intact. If you're a runner, please do not pivot from your hip so your head is about 12 inches in front of your pelvis. it's very important to keep your biomechanics a slight 5 to 10 degrees forward body tilt from your pelvis when you're running is okay. But, being fully 30, 40 degrees forward as you're striving to get through that inclination on the treadmill of 5 or 6 and your whole body is leaning forward, that is terrible, like terribly damaging to your body. You don't want to do that. You don't want to be seen looking like that at all. So now we talked about exercise. Your ankle, one of the first treatments for your ankle is typically wrapping it, right? So that is a protection for your ankle. So there's different types of wrap. I'm sure you can go on Amazon and find 1,000 of them, right? But what is right for you? So wraps have an inverse relationship between comfort and stability, right? So there is an inverse relationship between comfort and stability when it comes to wraps. So the first one we look at is a sleeve wrap. Sleeve wrap is basically, does not offer much stability, but it's super comfortable. It has more of a compression feel. So if you want to just put it on and you feel comfortable with that, go for it. But identify if there's a problem. Don't try to cover it up with a comfortable sleeve wrap, right? Then there is actually a strap wrap, which is more of a Velcro style. It's a little bit more rigid. And as you go into stability, they become more rigid. And those tend to be a little bit more popular for kind of like stabilizing you until you get to your doctor. Then you have the stirrup, which is this one. And that's definitely more semi-rigid. It involves soft and rigid together. And then there's the type that is the most rigid, and that is the lace-up one. The last type of wrap that you see is a hybrid. A hybrid is a combination between the soft, the Velcro, the semi-rigid, and the full rigid. And that is something that's mostly offered in more severe cases. So how do you wrap your ankle? What do? You want to make sure you put your ankle in a stable position or more of a neutral position. So the first thing you do, remember that tibia, fibula, or the end of the lower leg bones that we talked about? First, stabilize those areas. Okay, you anchor below the calf around the foot to stabilize the tibia and the fibula. And then you're going to have 3 strip ups, and you're going to go from middle to the outside in an inversion. So you start from your inside of your foot, and you just bring the tape underneath your arch, underneath your heel, and tape it up to the inside on top of the wrap above. And these are the stick-on straps that we're talking about. And then after that, you're going to secure the ankle itself, and you do like a close-up of your ankle. Following that, you do a figure 8, and you start on the middle part, and you work your way out as you go along. So you can actually see on this picture, you start down here, and you go outside, back in, and come back, and you just keep wrapping around the ankle like a figure 8. And then we're going to definitely want to do another round. So it's 1, 2, 3, 4. You got the ankle strap, and this is making sure that the tibia, fibula, talus, navicular, and also your calcanea are all stable together. And you're just going to wrap it up with either a soft wrap or another tape wrap in between them. So make sure it doesn't wrinkle, and try to just keep pulling on the strap, and do not choke your skin. Give yourself more comfort, because there's nothing worse than having too tight of a strap. You create more swelling and have to just scissor it all out, all of them. So then we talked about price to protect your foot. Here's another different type of, this is more of a soft non-tape wrap. So you kind of overlap, start from your foot, and again, figure 8 and secure the calf. So you could either start from the top if you're doing tape wrapping, but if you're doing soft wrapping, you start from the bottom of your foot. You could have your foot suspended on the air, and this is like you just put a couple of pillows under your calf. So your foot is non-weight bearing, and you start from your toe and you work your way up. The figure 8 is what stabilizes the ankle. Obviously, massaging your feet and massaging around your calves is going to be very effective. Icing the area is going to be very effective. And obviously ankle sprain exercises. And you want to exercise when your pain level is reduced. And these are typical things that you can do, a typical type of exercises. First, you always want to start with mild exercises, which where I like is C, which is alphabet exercise. This is what I highly recommend when a patient is first coming in. And you could use writing the alphabet in the middle of the air or in water. So if you have acute pain, and you want to reduce swelling, and it's, let's say, 2 weeks a day, 48 hours past your injury, you definitely want to continue icing. Put your foot in water, preferably cold water, and slowly and gently towards your tolerance, start writing the alphabet, capital A through Z. And you do that with your toe going up, exaggerated motions down, and just start writing it with your toe. But you notice that you feel different stretches in different parts of your ankle. Then obviously there is dorsiflexion, which is you flex your foot and you hold it and you feel the stretch in the bottom of your feet and your Achilles tendon. Then there's plantar flexion, where your toe comes downward and you feel it in the front of your ankle. Bring your foot inside, which is inversion, and then eversion out exercises. These exercises are really just a range of motion of the ankle. Just do it very slowly to your tolerance and work your way up to a full range of motion with no pain. And then once your pain is down to 1 or 2, and you feel more stable and you don't have pain with the ranges of motion, it's then that you want to do the more aggressive exercises of resistive ranges of motion and isometric exercises, calf stretches, and then talking about balance exercises are going to be very important. So now that we broke down your exercises, generally start with passive, go with semi-active, and then go directly into resistive exercises. Going back to posture, we have a whole webinar on posture, so you're more than welcome to go to our website and click on the webinar that suits you best. But standing is, I like to mention the popularity of sit-stand desks right now and at work. Just make sure you stand during the day and you sit during the afternoon. This balances off the amount of weight that's being placed on your ankles, reduces the aggravation to your ankle problem, and also does not cause other side effects of standing for a prolonged period of time. So if you do know that you have a posture problem, I have put together a kit. And for people who are attending this event today and you're listening, we have a special coupon code for you to get your own posture kit, which comprises of 3-4 different items. One, you get a set of massage balls that you can work on the tight muscles, whether it's on your feet, ankles, calves, lower back, upper back, or if you have that forward head carriage that works on your upper traps area. It also comes with a posture support. The posture support that we chose specifically for this home posture kit is specifically the BAX-U posture support. Reason being is doesn't pinch your and shave your skin or pinch your armpits like everything else does. It has university studies. It's covered on your flex spending account, health savings account, and it's adjustable. That's the beauty about it. So you can actually, if you got that rounded keyboard type of shoulders, you can adjust your shoulder. I highly recommend you wear if you're a runner or a walker, make sure you wear your posture strap from your posture home kit and then go for a walk so you can actually hack the nervous system and retrain the biomechanics of your body by biohacking the musculoskeletal system. So this is what I recommend. This is your coupon code. Get it if you have a problem. It is the least amount of money you can spend for the costing in medical problems that you might have to face in the future. I also created other kits because I created these for my patients because of years of telling them what to do and how to do, get a resistive band, get a massage balls, what kind, which one, how, what. So let me just save you the trouble of going through and trying to solve what is a good product. This is an accumulation. If you have headaches, we have a headache kit. If you have a neck pain, I have a neck pain kit, especially if you're feeling that neck pain radiating to your shoulder, back, or even fingers, you definitely want to get the neck pain kit, because of that neck pain, you are compensating your biomechanics. And obviously, get your poor posture. If you do get the kits, you actually can use the code 20NOW. So if you're attending, and if you know it, you definitely have an advantage to whoever else is not attending the seminar, and you're going to save money and save your time. Instead of waiting in a doctor's office, I'd rather you be happy doing something you love. My name is Dr. Ghassemi, and I hope this Wellness Wednesday webinars are helpful to you. I appreciate it if you share this with others. Next week, I'm going to talk about foot pain and plantar fasciitis. What is it? How do you fix it? How do you prevent it? My goal is to help you have a better life. I may not reach all the people that I can. However, I am available for telemedicine. You could go to my site, thinkhealthy.com, and sign up for an appointment. You could get any of the kits that you like, and share the message and share what you've learned. I thank you for your time, and I really appreciate your attentiveness. Have a wonderful day, and stand tall so you can feel better.